Hello friends, welcome to my channel. This is Medical Link Rapid Revision. So now we are talking about mantle cell lymphoma. So mantle cell lymphoma is a mature B cell tumor. Which originates from mantle zone of lymph node. So it originates from the mantle zone. So the marker CD5 will be positive. This CD5 positive is a marker of mantle zone. It is more commonly seen in adult male more than 60 years of age. So most common presentation. So what is the most common presentation? So most common presentation is painless cervical lymph node enlargement. So what is the characteristic presentation of mantle cell lymphoma? So main characteristic presentation of mantle cell lymphoma is the pattern of spread. So there will be lymphomatoid polyposis. So there will be lymphomatoid polyposis, that is tumor cell will infiltrate the intestinal mucosa. So tumor cell will start to infiltrate the intestinal mucosa. So there will be numerous small and large polyps which are scattered in the ileocecal region. Now coming to the diagnosis, you do immunophenotyping. So you will see for the marker CD5 and CD23. CD5 will be positive and CD23 marker is negative. Now in cytogenetics, there will be translocation of chromosome from 11 to 14. This will confirm the diagnosis. Now when there is a translocation from 11 to 14, this will cause overexpression of cyclin D1 protein. So there will be overexpression of cyclin D1. In case if the cyclin D1 is negative, what if cyclin D1 is negative? So when cyclin D1 is negative, you do SOX11. So SOX11 is used when cyclin D1 is negative, and this will confirm the diagnosis. On histopathological examination, you will see a neoplastic lymphoid cells surrounding the small atrophic germinal center, which will produce a mantle zone pattern of growth. So these are different zones of lymph node tissue. So the innermost is the germinal center, the middle one is mantle zone, and the outermost one is the marginal zone. So here the germinal center is atrophic. Around the germinal center you will see the neoplastic lymphoid cells surrounding the atrophic small germinal center, which will produce a mantle zone pattern of growth. And also there will be homogeneous population of small lymphoid cells with irregular nuclear outline, with prominent nucleoli and scanty cytoplasm. So the nucleus will appear as a butt-like. So these are chondrocytes. This buttock cell are also seen in follicular lymphoma, is also seen in mantle cell lymphoma and mycosis fungoides. So these are chondrocytes. Now let's revise the whole thing. So mantle cell lymphoma is a mature B cell tumor which is of mantle zone origin with CD5 marker positive. It is mainly seen in adult male more than 60 years of age, and it presents with painless cervical lymph node enlargement, and it is characterized by lymphomatoid polyposis. So how to diagnose? So you do immunophenotyping, where you see the CD marker CD5 positive and CD23 negative. Cytogenetics, translocation between 11 to 14, which will cause overexpression of cyclin D1, and you can do SOX11 to confirm the diagnosis. On histopathological examination, you will see neoplastic lymphoid cells which is surrounding the small atrophic germinal center, which will produce a mantle zone pattern of growth. So you also see homogeneous population of small lymphoid cells which are irregular nuclear outlines with prominent nucleoli and scanty cytoplasm, which will give which will give a buttock-like cell known as chondrocytes. And in mantle cell lymphoma, centroblasts are absent. This is all for today. Now we'll see you in the next video. Thank you for watching, and please do like and subscribe my channel.